This is a 22-year-old female who comes in interested in a rhinoplasty. You can see on frontal view there's a bit of C-shape deviation to the dorsum here. You can see there's significant infralobular fullness. There's retraction of the ala on the left and right side. The foot of the ala also is asymmetric, being a little bit higher on the right than the left. There's not good tip definition, and there's some cephalic malposition here of the lateral crus, shadowing here that's really amplifying that C-shaped deformity. On smiling, you can see that the lip comes up and disappears. This is sort of a tension tip type deformity. The ala hike up even more, especially on the right compared to the left. The infralobule, which is asymmetric, comes down more on the right than the left. On base view, you can see some asymmetry of the nostrils, a bit of a wide alar base, some flaring and fullness of the mediocrural feet, and you can see the hump is more prominent than the tip itself. Again, you can appreciate that deviation and collapse on the left portion of the dorsum. Here on 3/4 view, you can appreciate that there's almost a hooked appearance of the nose, this infralobular fullness. You can start appreciating the alar columellar disproportion given the retraction of the ala and also the caudal septum and mediocrural feet being down more caudally. Here on lateral view as well, you can see there's no super tip break. There's infralobular fullness, alar columellar disproportion, cephalic malposition, retraction of the ala. The supranasal region or subnasally region is very full. Here on the opposite side, lateral view as well, lack of a super tip break, not good tip definition, prominence at the infralobule, subnasally fullness, alar columellar disproportion, and an obvious hump. Radix is at good position, nasofrontal angle is quite good. Here on smiling, you can see that the ala hike up more obliquely. The infralobule appears to plunge. A lot of this is really the lip hiking up at the same time, and that alar columellar proportion or disproportion gets worse. This represents the rhinoplasty diagram of what was accomplished. We performed high-low to high osteotomies. We performed auto spreader flaps from the upper lateral cartilage, folding these in. We placed some crushed cartilage and fat overlying the dorsum. A judicious cephalic trim. We placed articulated alar rim grafts here. In the rims, we excised or gently trimmed the mediocrural feet. We performed a septoplasty, some caudal septal trim, some tongue and groove in terms of repositioning the lower third of the nose. Post-operatively, you can see in a subnasal view, which is often the hardest to correct, much better support at the ala, more equal nostrils, less fullness in the mediocrural feet region, better support, more appropriate infralobule to tip, and then nostril dimensions. Here on frontal view, you can appreciate how much straighter the nose is. There's better tip definition where you can see the 3 points. This is straighter. The C-shaped deformity has been addressed. The ala that are hiked up, especially on the right, has come down significantly, and there's much better balance, longer appearing upper lip as well, less infralobule fullness and asymmetry. Lateral view, again, you can see how much better the ala supported. There's a nice super tip break. The nose looks straight. There's less fullness. There's a better dimension from tip and infralobule to the nostrils themselves. 3/4 view, the same thing, less alar columellar disproportion, longer appearing upper lip, nice nasolabial angle, a bit of a super tip break, more refined and defined dorsum to the tip. And lastly, on lateral view, when she smiles, this dynamic position, there's less plunging, less retraction of the ala, less heightening of the lip here, and this alar columellar proportion or disproportion has been improved. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com.
Thanks again.